Dental disease is one of the most common health issues that can affect dogs and cats. Dental disease can cause discomfort, pain, bad breath, and can lead to other diseases as well. Once gum disease is present, the only way to treat that is to have your vet scale and polish the teeth. So this procedure is very similar to what your dentist will do for you. We do need to sedate or anaesthetize a pet because they can't tell us when they're in pain and feeling pain or discomfort, so it's much more gentler for them to do it this way. We'll use general anaesthetic, and this will keep them nice and comfortable. It will keep them asleep for the procedure, so they won't remember what's been happening, and they'll wake up with a nice clean mouth. Before the procedure, your vet will go through how to care for your pet. That will involve giving them their meal as usual at night time, and then we just fast them after that point, so they won't have any food in the morning, but they will have something to drink. On arrival, the vet team will generally take you through for an admission. You'll sign a consent form. They will answer any questions that you may have about the procedure and confirm your contact details, and then they will take your pet out to the ward. So before your pet has the anaesthetic, we do a thorough examination. So we'll check their heart and their lungs and make sure that their gums are looking nice and pink and moist. We check their temperature as well, so this is just called a standard examination. We will take blood to make sure that they are healthy for a general anaesthetic to be done safely. That will check predominantly their liver and kidney levels. The blood test will also help us to identify any issues and tailor the anaesthetic plan accordingly. So once your pet has had their sedation, a catheter will be placed in their vein in their arm. They will be taken to the anaesthetic table and procedure area. We will connect fluids to the catheter to make sure that they're staying hydrated and supported throughout the anaesthetic. Once we've given the general anaesthetic, we will put a tube down their windpipe, and that will help them breathe. Throughout the procedure, the nurse and vet will monitor your pet very thoroughly with the use of an anaesthetic monitoring equipment. X-rays are a really common part of doing a dental procedure, whether it be just a clean or extractions. This helps us to see inside the tooth to look for any decay, and that might be done before the cleaning. So next, the team will use an ultrasonic scaler to break up the plaque that's on your pet's teeth, and that will do above and below the gum line, and that will remove any plaque, tartar or infection that's present. If we come across a tooth that may need to be extracted, we may do that at another time. Removing teeth can be a really long process, so we will measure the gum and we'll look at the condition of the tooth and decide whether or not it's best to come out then and there or come back at a later time. So after the scaling has happened, the tooth is quite abrasive, so we will rub a polish on there and use a polishing instrument to smooth out any rough surfaces on the tooth. The benefit of the polish is that it also helps to prevent any more tartar and plaque buildup and will help the teeth look brighter and cleaner. Once your pet has had their procedure done, they'll be transferred into the recovery ward and they'll be monitored by the nurse. The vet will give you a call to let you know that everything's gone well, and we will book a discharge time. Upon pickup, you'll have a discussion with the nurse or vet, and they'll go through some aftercare instructions with you. We generally encourage soft food for the first couple of days after a dental procedure, so it's important to keep your pet nice and warm for that night and monitor them closely over the next day.